Hi, I'm Dr. Nichelle Haynes.
I'm Dr. Kristin Lasseter,
And
we're Medical Mamas,
This is your place to get evidence-based information about your reproductive mental health.
meaning mental health in relation to reproductive hormone changes like pregnancy, postpartum, menopause, premenstrual disorders, even infertility.
Hey, today we're going to talk about a topic that's really popular right now, and that's ADHD in women.
You know, ADHD has traditionally been diagnosed really easily in boys because boys tend to have more of kind of this reckless hyperactivity kind of behavior, and so it's really easy to pick out, especially in a classroom. But girls are a little bit different.
So what you're talking about is basically there's two types of symptoms that you could have with ADHD. There's external symptoms and there's internal symptoms. So external symptoms would be the symptoms that other people could see from the outside, just like you're talking about.
So not being able to sit still for long periods of time, doing a lot of moving around and what's that called? Fidgeting. A lot of disorganization, like maybe their desk looks really disorganized, or you go to their house and it's really disorganized. Talking excessively, interrupting people, not being able to wait their turn, jumping around, talking quickly.
Mm-hmm. I think one of the things in the DSM is seeming like you're being controlled by a motor. Like you just have like a ton of energy and it's very obvious from the outside, so externally. And there's also internal symptoms, which are kind of like more of the inattentive type things, or things that other people can't see from the outside, so inside the person experiencing. That would be like, I don't know, being distracted, not being able to focus, avoiding tasks that require a lot of attention, being forgetful.
So those internal symptoms, which tend to happen more in women, girls, often get missed because they're not as obvious to people on the outside. And obviously for a person who's experiencing those symptoms, that to them is how they are. So they don't know that, oh wow, this isn't normal, until maybe later in life when they start observing friends or, family members and noticing like, that I struggle with this more than they do.
So the external symptoms are often like disruptive, and they require attention from adults so that there's less disruption in the classroom. So it usually will mean that it's brought to the attention of parents, that something gets done about it, that the person who is experiencing the external symptoms can have support and treatment. But internal symptoms get very further internalized by the person experiencing them. And like we said, internal symptoms happen more with girls or women. So that can lead to a whole other host of problems.
Yeah, so imagine if you're kind of struggling with internal symptoms and that you're avoiding doing your homework or you're procrastinating. It can make you feel like you're not as good as somebody else, or maybe it causes a lot of anxiety for you because now you have all these things that you need to do, but then that further makes you want to procrastinate. So it's very common that we see women presenting with actually anxiety or depression that might be caused by their ADHD.
When I think about this, give it the umbrella of like, why do I suck? Right? Why is this so hard for me? So I see the mood component come in like kind of the why do I suck? Like I am struggling to get things done. I can't get things done in the same way that other people get them done, or I'm forgetful and so I must not be good, right? So the mood component, and then the anxiety component comes in like you notice that you're forgetful, and so you're worrying about what did I forget, and that becomes kind of the norm or the standard, like I've forgotten something, and so the anxiety comes in to remind you that you've forgotten something. Like you said, a lot of people will show up with anxiety, and yes, they do have anxiety, but also there's an underlying ADHD or inattentive component that has contributed to why the anxiety might also exist.
And it's really important that when you are experiencing these symptoms that they're assessed correctly. So seeing somebody who is actually trained in diagnosing and treating mental health disorders is really important, because the way that you treat these disorders needs to be strategic. You don't just kind of throw stimulants at someone. You know, you're wanting to treat kind of what is the underlying disorder, and then what is left over that we need to treat with other medications.
The stimulants are stimulating. So if you're already experiencing anxiety, and you're only experiencing anxiety, and someone gives you a stimulant, you might feel way more anxious. So there's lots of reasons that you would want to talk to a board-certified psychiatrist, someone who's very trained in teasing out these nuances and exploring this together, whether that means medications or that means like some other forms of therapy that you could use. It's important because ADHD, anxiety, mood, all kind of mingle together in a way that can be really confusing, and just jumping into a treatment may not be the right thing. So yeah, it's not just I'm forgetful, here's some stimulants.
Yeah, definitely not.
I think it's also important to note that ADHD doesn't just show up one day.
They don't just all of a sudden show up in adulthood. These are symptoms that have been there from the beginning when the person was a child. They're actually neurodevelopmental disorders, meaning they were there when your brain was developing.
I will say though, that it's not uncommon for women to come to me, I don't know, maybe they're postpartum with their first or with their second, and the demands of their life are overcoming the things that they used to use to overcome their ADHD.
Right, so maybe you were really, I don't know, disciplined child who could, you know, yes, you'd want to procrastinate, but you managed to kind of work your way around those things. You kind of had some other coping tools to help you, you know, with coping with these these symptoms that you were experiencing. But now you're a mom of 2 kids, you work full time, you're managing the house, and it just gets to be too much where those coping skills that you used to use aren't going to cut it.
I don't like the term ADHD. I don't think it's an attention deficit. I think you can attend to the things, you just can't focus your attention, right? It's like an attention placement deficit. Because often I see people come to me and they're saying, oh, I'm very overwhelmed by all the things that are happening in my house. I have a kid, I have the music, like I just get very overstimulated. And it's not that you can't attend to things, you're just not able to focus it. Like you hear the music, you hear this, you hear all that. So the attention gets spread out rather than like focused.
It can be very overstimulating.
Right, yes, exactly. So mom rage can be one of the things that I'm like, let's talk about what you were like when you were a kid. And it seems like an abrupt shift in the conversation, but it's more of like, let's see what could be underneath this like mom rage thing. So
yeah, but mom rage could also be from anxiety,
right,
could be from depression, could be from bipolar disorder. And so this is why it's really important to see somebody who is experienced in treating these disorders.
Really complicated topic, very popular right now, because there's just a way in which now people who may have had a lot of internalized symptoms are more aware because of social media, or you know, just more people being aware in general and talking about these kinds of things more openly, are now seeing like, wow, I don't suck, maybe I just really have a problem with attention. And it's been really lovely to see a lot of people get treated and really have big improvements in their life.
Definitely.
I love treating ADHD. It's so great. I love it. Thank you for being here today. We really appreciate you. If you like this video, please like, comment, subscribe. If you have questions, please let us know. We'll answer your questions for you. We'll see you soon.